Hi, my name is Alex O'Brien, and today I'm going to discuss the topic of post-term pregnancy. The normal duration of pregnancy is anywhere between 37 and 42 weeks in duration, and this is referred to as term. Therefore, the WHO has defined a post-term pregnancy as a pregnancy that has extended to or beyond 42 weeks in duration. This is also referred to as term plus 14 or 14 days past the estimated due date. Up to 10% of pregnancies extend past this point, and the exact causes of this are unknown. However, risk factors for a post-term pregnancy include a first pregnancy, a previous history of post-term pregnancy, genetic factors, obesity, advanced maternal age, or a male fetus. A possible cause may also include a miscalculated estimated due date, for example secondary to irregular menstrual cycles. However, this is uncommon if the woman has had an early pregnancy dating scan. Unfortunately, there are some risks associated with a post-term pregnancy for both the mother and the fetus, and we will next discuss these. Firstly, the incidence of stillbirth rises from 39 weeks onwards, with a sharp increase after 40 weeks. Although relatively, it still remains a small risk. The incidence of stillbirth increases from 2 to 3 cases per 1,000 pregnancies at 37 weeks to 4 to 7 cases per 1,000 pregnancies at 42 weeks. Secondly, beyond term, the fetus is more likely to have a bowel motion called meconium into the amniotic fluid, and this can cause breathing problems when the baby is born if the baby inhales the meconium-stained amniotic fluid. Furthermore, post-term babies are more likely to be macrosomic, i.e. greater than 4 kilograms, and this can pose some risks both to the mother and the fetus. For the mother, it can cause difficulties in the labour, resulting in a prolonged labour with an increased risk in injury to the perineum, as well as an increased risk of postpartum hemorrhage, endometritis, and an increased risk of needing an emergency caesarean section or operative delivery, with the resultant added risks of these. For the fetus, macrosomia can increase the risk of difficulty passing through the birth canal and resultant birth trauma, for example, fractured bones or nerve injury secondary to a shoulder dystocia. Furthermore, a prolonged pregnancy may be a source of significant anxiety for the mother, and this may have an emotional impact on the mother. Post-maturity syndrome of the fetus occurs in up to 20% of pregnancies extending past the expected due date. Features of this include dry peeling skin with a lack of vernix, a loss of subcutaneous fat reserved with decreased muscle mass, overgrown nails and abundant scalp hair, and staining of the skin with meconium. It is associated with a decrease in placental function, providing fewer nutrients and less oxygen to the fetus, which may be associated with oligohydramnios on a scan. The decreased stores of fat and glucose predispose these infants to hypoglycemia, hypothermia, and polycythemia. They may also suffer from meconium aspiration. Obstetricians may recommend tests on the fetus if the pregnancy extends beyond the due date. These tests give information about the health of the fetus and about the risks or benefits of allowing the pregnancy to continue. Amniotic fluid volume is important because a low volume may be a sign of changes in the feto-utero-placental circulation, signifying reduced placental perfusion or placental insufficiency. Adverse outcome is more common when there is oligohydramnios, meaning a reduced amniotic fluid volume. A cardiotocograph or CTG may also be performed to check fetal well-being, particularly if there are any concerns such as a reduction in the amount of fetal movement reported by the mother. Fetal movement monitoring by the mother is very important in a post-term pregnancy, as normal fetal movement is a good sign that indicates that the baby is still in good health. The best time to deliver a baby in a woman who is post-term is sometimes hard to determine. This decision must be made by the healthcare professional and the mother after considering the risks and benefits of continuing the pregnancy, the results of the fetal monitoring tests, the condition of the cervix, the gestational age, the estimated fetal weight, patient preference, as well as their past obstetric history. Usually, the cervix begins to thin out, which is called effacement, and open, which is called dilatation, towards the end of a woman's pregnancy. But induction of labour is more likely to fail in women whose cervix is not thinned or dilated, which could result in the woman requiring a caesarean section with the added risks of this. This is why we must weigh up the risks associated with prolonging a post-dates pregnancy whilst we wait for either spontaneous onset of labour or an increase in the favourability of the cervix versus the risk associated with induction of labour. The Bishop score is a scoring tool which is used to assess the favourability of the cervix for induction. The total score is achieved by assessing the following 5 components on vaginal examination: cervical dilatation, effacement, consistency, position, as well as the fetal station. A total score greater than or equal to 6 usually indicates a favourable cervix. At the time of the vaginal examination, the patient may be offered a sweep. This involves inserting a gloved finger inside the cervix and making a circular sweeping movement to separate the membranes from the cervix. This has been shown to increase the chances of labour beginning spontaneously within 48 hours. The success ratio for this is 1 in 8. Generally, the induction process will involve either prostaglandin medication or artificial rupture of the membranes. Prostaglandins are medications that are inserted into the vagina to help induce labour by encouraging the cervix to soften and shorten. This allows the cervix to open and causes contractions to start. These are usually used if the cervix is not dilated at induction. Artificial rupture of the membranes is performed either in the first instance as a method of induction if the cervix is dilated, or else following the administration of prostaglandin medication which has caused the cervix to dilate. Sometimes prostaglandins and or the rupture of the membranes is enough to start the labour, but many women require oxytocin, which is a medication given intravenously which causes the uterus to contract. In summary, a post-term pregnancy is a pregnancy that has extended to or beyond 42 weeks in duration. A pregnancy extending beyond the estimated due date will usually require an increase in the surveillance of the fetus because of the increased relative risks. Generally, in a straightforward pregnancy with no complications, induction of labour is offered between term plus 10 or term plus 14. Favourability of the cervix is assessed for induction of labour using the Bishop score, and a sweep may be performed to try to decrease the interval to spontaneous onset of labour. Finally, in summary, the risks and benefits of prolonging the pregnancy must be weighed up against the risks and benefits of an induction of labour.